Hello, this is Dr. Angela Cortal, and this is the video Q&A follow-up to the series I've been doing this week, all about things that are stem cells, are not stem cells, or maybe kind of sort of stem cells. So I got a whole list of questions here from the stories that I've been posting this week, and wanted to go through some of those questions and provide answers as best I know. I guess first off, I just wanted to mention why I'm doing this, and that's all about education. I want the word to get out there to patients, to prospective patients, so they know what to ask for, what to look for, what the truth is, what the not so truth is around advertising as it comes to everything that's calling itself stem cells out there. Because there's a lot of not so conscientious behaviors happening. So I just want to get the word out there to patients and also to providers who are in this field so that they know, or at least should not be surprised when the FDA comes knocking saying that your advertising practices are not compliant and cease and desist. So getting into the questions, do I do these? I probably should have put this a little bit more into the series. But I do not offer anything that I'd call these embryonic or amniotic placental derived tissue injections yet. A lot of this series is about me plodding through all the research, all of the information that I can find out about it to figure out should I be, what would be the best thing to offer patients. I want to be providing the best care like anyone out there. And so this series was really my way of looking through that research, trying to figure out what products, if any, should I be offering my patients. And I've come away with a couple new resources that I've been given from other doctors who have been looking at my series as it's been posted this week. And so that's really great. I've been having some really great conversations away from the posts and the stories as well. So I think it's really started some wonderful communication out there. And I might be offering these in the future. I will definitely post that if I do. And I'm still in the research gathering phase, I would say. Someone was asking about side effects or poor outcomes and like any kind of injection procedure, especially if it's going into joint capsules, that is kind of a little bit invasive. And so you can definitely have side effects whether that might be bleeding, bruising. I mean, I would imagine that any of these injections have the same sort of side effects as what I'm talking about with my patients with prolotherapy or PRP. And I mean, beyond that, there can be contamination issues because there's often a lab company who's making this, and then it's going to the doctor's office, and then it's being injected into the patient. So with those multiple hands, there's multiple steps where something, if it's supposed to be frozen, could accidentally get thawed, and if a doctor didn't catch that, then yeah, there could be a little bit extra contamination concerns, but any good quality doctor is going to be able to verify that for their patients. To be honest, the biggest poor outcome I can think of is ineffective treatment. If a procedure is $2,000, $5,000, $10,000, I've heard as much as $20,000, and it doesn't do you any good, that's the biggest side effect in my book. That's the biggest downside. Someone was asking about cost, and so I just mentioned that. Yeah, they're always in the thousands. It's a complicated issue as to why these cost so much. There's a lot of technology in it. There's a lot of marketing and advertising from these lab companies that are rolled into that. But the doctors are still, as far as I can find out, being charged about $750,000 per cc. That's a teeny tiny little vial. There might be specialized kits for in-office preparation for the injection. So that the offices themselves that are offering these often are putting in around, I would say around at least $1,000 per procedure for these often. And last question, I like this. This is going after my own heart here. If I got any blowback from other doctors for doing this, and I thought I would. I anticipated a little bit more pushback. What I've been talking about this week, I think should be talked about more and is just really not out there as much as I think it should be. And I did not get any hate DMs. I did not get any profanity sent my way. I definitely got a couple of questions. I got some clarifications from providers offering a couple of things I hadn't even heard of. But no, I did not get anything extremely negative coming my way, and I think it actually did quite the opposite. Really opened up lines of communication, and I was able to provide what I knew and research links to other doctors, and they did the same to me. So I think it was overall just a really positive experience. If you do have any follow-up questions, feel free to throw those in the comments on any stories or posts for this series. Thanks.